Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. Quick note whether the audio visual is all good. Is the audio visual all good, guys? A quick nod. Okay, that's great. So, first of all, I would like each one of you, so we tried something new today. We had a test before we are discussing the MCQs. Like, we used to have MCQ discussion, but today we tried something new. कि सबसे पहले हमने एक test ले लिया, like in the last half an hour. So please tell me how much did you score in the test? Let me know how much did you score. I hope you are also doing the today's target of general and CVS pharmacology, right? So I can see Dr. Jairi 14 marks. How about others? Dr. Actually 28. Amazing. Pharma का timetable तो मैं already दे चुकी. The targets have been shared on the Telegram group already. है ना? ठीक है पलक I would strongly suggest that stay connected on Telegram so that you don't miss on any new updates notifications that we share on the group as well. ठीक है चलो great. So there's a room for improvement, right? Let me show you the top 5 students. ठीक है the top 5 students that we have. So I hope all of you can see this. So the first ranker is Apurva Girish. Then we have Sayantan. All right. Then we have Sayantan, then we have Aitri, Chakravarti, and Aparna and Kushi. And you would see that these are the 5 students who have actually got 28 marks. That is all correct. So it was 7 questions, right? 4 marks. So 28 all correct is what these students have got. So that is super awesome. Okay, that's super awesome. So congratulations to the toppers and everyone. But never mind, let's learn the tricks of the general pharmacology numericals with the questions that we had. For those who missed the test, we are already discussing the questions. Still, if you want to see the platform, you can do that. There's a link in the description as well for where you can take the test. Okay, so if it sounds good with everyone, I'll share another test. Beach mein it will keep happening so that we take a test and we do the discussions, right? Okay, so let's start with question number 1. This was the first question that we had. I'll be sharing the tricks on how to remember the formula, basically in general pharmacology, right? Very important. Okay. So the amount of drug administered to a patient is 4 gram and its plasma concentration is 50 milligram per ml. What will be the volume of distribution? Okay. Now see, volume of distribution, as the term says, you can look at the units also. The unit of volume of distribution is liters. Okay, the unit of volume of distribution, it's a volume. So into how much volume the drug is getting distributed, that is the volume of distribution. A drug which has high volume of distribution, right? What do you mean by that? So when you are giving this drug IV, it is going into the tissues, out of the bloodstream into the tissues to saturate those spaces. So that is why a drug which has high volume of distribution, it requires a loading dose, right? These drugs require loading dose. Why? Because you want to saturate these extravascular spaces, and then the concentration of the drug will rise in the bloodstream, right? So a loading dose is required. So what is the formula for the relation of loading dose volume of distribution? Remember LVP, that is LV Prasad Institute in Hyderabad, which is very famous. Remember LV Prasad, that is LVP, that is loading dose is equal to volume of distribution into the plasma concentration. This is where we generally tend to make the mistake. Volume of distribution is equal to loading dose into the plasma concentration. Yeah, loading dose is equals to volume into plasma. So remember, it's LVP. Loading dose is equals to volume into the plasma concentration. Now the question is asked about the volume of distribution. So the volume of distribution will be basically equal to loading dose upon the plasma concentration. Loading dose is how much we have given to the patient. That is 4 grams. Okay, that is 4 grams. So we need to convert this also, right? Units, बहुत ज़्यादा units देखने की यहाँ ज़रूरत नहीं है because the values are different. So 4 divided by 50. So if you see, it's gonna come 5. 8 is a 40. So it's going to be in the multiples of 8. So the answer is 80 liters. If there would have been options like 80 liters, 8 liters, 0.8 liters, then I would have bothered about doing the conversions, grams to milligram. I would have done all of that. But when there is no such confusing option, and at that time, save your time by not doing the conversions of the units, right? Understand this point in the numericals. When do you want to convert and when there's no need of conversion? All right. So remember, this is basically the formula that we need to know. That is LVP. That is loading dose is equal to volume of distribution into the plasma concentration. Okay. And Apurva, I don't know whether Apurva is here. Yes, the entire nation wants to know, how did you do all those questions in such a less time? It's like 0.58. How did you actually do that? So the entire nation wants to know. Please let us know and enlighten us as well. Yeah. Another formula to be remembered here is, this is about maintenance dose. This is loading dose. This is maintenance dose. Right. This is for IV route. Neetu, we have another question where we will come to oral administration as well. How does that different, is different. Maintenance dose, remember, is MCP. That is like your middle cerebellar peduncle. वैसे याद रखना MCP, LVP and MCP. So maintenance dose basically is equal to clearance into the plasma concentration. So remember that maintenance dose depends on the clearance. Loading dose depends on the volume of distribution. So if you remember this formula, the tricks basically LVP and MCP, you'll remember that these two are interrelated. Okay, these two are interrelated. So clear with everyone, both of these is basically for the IV route. How the other routes change the formula, we'll be seeing a question on that as well. Okay. Now what is the relation? Many times you'll get numericals where you are given volume of distribution, you are given clearance, and you are asked calculate the half-life. So this is the third important, okay, this is the third important formula in general pharmacology that we should know. So it is T half n is equal to 0.693, that is approximately 0.7 into, again, anytime you get confused कि मेरे को multiply by clearance by VD करना है or it is VD by clearance. The easy way in the examination hall, if you tend to forget the formula, try to put the units. Okay, try to put the units. That is, VD ka unit hai liters. What is the unit of clearance, guys? Yesterday in renal physiology we saw. What is the unit of clearance? What is the unit of clearance? कल पढ़ा था ना? The amount, the volume of plasma which is cleared of a substance per unit time. So what is the unit? It is the volume cleared per unit time, that is liters per minute or liters per hour. So when I do this, the minutes will go up, liters will get cancelled. So the unit is coming in minutes. If I do clearance upon VD, that is liters per minute divided by liters, this will come as a unit of 1 per minute, right? Which is not the unit. So remember, this is how you'll derive the formula if you forget in the examination hall. देख लो कि unit कौन सा सही बैठ रहा है. Okay, so remember it's VD upon clearance. This is how we will derive T half. Let's go to the next question. Very, very important concept in general pharmacology. Which is correct concerning the safety of using warfarin, which has a small therapeutic index, versus penicillin, which has a large therapeutic index? Basically, let's understand the concept of therapeutic index. Now, what is therapeutic index? So look at this graph. Therapeutic index is basically this window. What is this window between? the drug dose at which the therapeutic effect is seen and the drug dose at which the toxic effect is seen. So this window here is basically the therapeutic index. Now let's understand two drugs, one which has this narrow therapeutic index and one which has a wide therapeutic index. Okay. Now what does that mean if any drug has a narrow therapeutic index? This is the therapeutic dose and this is the toxic dose. Let's say 5 is the therapeutic dose, 6 is the toxic dose. Here 5 is the therapeutic dose, 20 is the toxic dose. So what does that mean? That if the drug concentration is increasing from 5 to 6, the toxicity of the drug will appear. Here if the concentration increases from 5 to 20, then the toxicity will appear. So basically in narrow therapeutic index, we need to be so cautious about the drug levels because thoda sa bhi drug level upar gaya, it will lead to toxic effects, it can lead to lethal effect also. And that's the reason that these are the drugs where we need to do therapeutic drug monitoring, right? The TDM, that is the therapeutic drug monitoring. So basically this is done for drugs which have narrow therapeutic index, that means which are relatively unsafe. Their safety index is low because thoda sa agar hua बढ़ गया and it can lead to toxicity, right? So basically a safe drug is a one which will have a wider therapeutic index, And important question, this has been asked in the previous FMGE exam also. What is the formula for the therapeutic index? It is, remember basically TILE. Okay, TILE से याद रखना TILE. ऊपर आएगा lethal dose, नीचे आएगा the effective dose. Or it can also be called as toxic dose because it's not always the lethal, the death which occurs. Toxic dose upon the effective dose. I think you had a question in the today's pre-test where you were asked to calculate the therapeutic index. If the lethal dose, toxic dose was given as 128, the minimum effective dose is 8, and you were asked to calculate, right? So this is basically very, very important. Now let's go to the question here. What is correct regarding safety of warfarin, which has a small therapeutic index, versus penicillin, which has a large therapeutic index? Warfarin is a safer drug because it has low therapeutic index. Incorrect, right? This is false. Lower the therapeutic index, it is more unsafe. Warfarin treatment has a high chance of resulting in dangerous adverse effects if the bioavailability is altered. Yes, because bioavailability change hoga, drug levels change honge, narrow therapeutic index, it can reach the toxic effect. The high therapeutic index makes penicillin a safe drug for all the patients. It is not so. Any drug which has a wide index does not mean that it will be safe in all the patients. There are these side effects which are called as idiosyncratic or basically unexpected side effects like the allergy. It can occur in any patient. So it's not necessary that any drug with wide therapeutic index will always be safe in all the patients, right? Penicillin treatment has a high chance of causing dangerous adverse effects if bioavailability is altered. No, because this has a wide therapeutic index. So we have more margin of changing the availability, changing the drug levels. Okay, so the correct answer here is going to be B. Is this understood by everyone? The concept of therapeutic index and narrow therapeutic index basically needs therapeutic drug monitoring. Okay, that requires therapeutic drug monitoring. And remember that therapeutic index is basically a measure of safety of the drug. This is another question. Another one, formula is LD50 by ED50. Okay, the formula is LD50 by ED50. Okay. Let's go to the next question. Now, this is a question which is very, very interesting. Let's see how many of you have got this right. A 64-year-old female patient is treated with experimental drug A for type 2 diabetes. The drug is available as tablets with oral availability of 90%. Volume of distribution is 2 and the plasma concentration is 3. Which of the following is the most appropriate oral loading dose of the drug A? So whenever there is this question of loading dose, the formula that comes to mind is LVP. That is the volume of distribution into plasma concentration, right? Now, what is the trap which is being used here? The volume of distribution here, the value that you should be taking is not 2, because the volume of distribution is given as 2 liters per kg, and the weight of the patient is also given, which is 60 kgs. So the volume of distribution is 2 liters in 1 kg. So basically for 60 kg ka weight patient, it will be 2 into 60, that is 120 liters. So absolutely right, Sayantan. Basically, the value to be taken here is 120 liters. We don't want the value in liters per kg. And that's the reason that the weight of the patient has also been mentioned. So whenever the weight of the patient is mentioned in questions with volume of distribution, that should raise an alarm. Probably I need to look at the unit of volume of distribution, right? Plasma concentration required is 3. So the loading dose is not 120 into 3, that is 360. Why? Because we are not giving the IV route here. ऐसा नहीं है कि जितना drug we are giving, everything is reaching into the bloodstream. 100% bioavailability नहीं है, 90% है. Okay, it is 90%. So the formula for other routes is basically divided by F. That means the fraction which is available, the bioavailability. So it is divided by 0.9. So basically 360 divided by 0.9, that makes it 400. Think logically. You know how you could have solved this question is, अगर हम ये ड्रग IV दे रहे होते तुमको 360 देना पड़ता. When the entire amount of drug is going into the bloodstream, 100% 360 is required. Now we are giving the drug oral. Oral drugs have first pass hepatic metabolism, first pass metabolism. So we need to give a higher dose because we want 360 into the bloodstream. The only number which is higher than the 360 in the options here is 400. 6 or 108 तो automatically out हो गए, right? So that is how also using the cheat codes you can come to the answer that is 400. कि definitely it will be more than 360. IV अगर 360 है तो oral उससे ज़्यादा होगा, ठीक है? Everybody is clear? So look at the formula. Loading dose is equals to volume of distribution into plasma concentration divided by the bioavailability का fraction. You have to divide by that fraction. Similarly, for maintenance dose, that is MCP, it is clearance into plasma concentration divided by bioavailability, but you have to also multiply by the dosing interval. In loading dose, there is no dosing interval, right? Because you give it as one dose, one shot. Here, maintenance dose, there will be dosing interval, BD, TDS, right? How many times in a day? So we need to multiply by that dosing interval also and divide by bioavailability. Clear with everyone? Give me a quick thumbs up so that I know that everybody is clear with this. Right? Now, so this was question number 3. Let's go to the next question, that is question number 4. This is an easy one where we have a pharmacokinetic study of a new drug is being conducted. Half-life of the drug is 12 hours, which is the best approximate of the time required to reach steady state. So basically remember that time required to reach the steady state plasma concentration is 4 to 5 half-lives. That is what you need to know. That's it in this question. Though the question looks lengthy and scary, it's an easy concept that a drug requires 4 to 5 half-lives to reach the steady state plasma concentration. This is 12 hours is the half-life. So 4 into 12, 48. So it is 48 to 60 hours basically. Okay, 48 into 60 hours basically. So the answer is 48 hours, which is given here. Thankfully, there is no option of 60 here. So there's no confusion. So the answer here is 48 hours. That is 4 to 5 half-lives. Okay. Next one. Now these are two very, very important concepts. One word here and there and the entire answer changes. This is why I always say that when you solve MCQs, try to also ask yourself in what other way this MCQ can be framed, and in that case how the answer will change. So 200 milligram of drug was administered, okay, per patient. 40 milligram was cleared in 90 minutes. How much of the drug would be left in the body? It's about left, not excreted. After 3 hours, if the drug is following zero order kinetics. Now, what is the concept of zero order and first order kinetics is what I want you to understand. Zero order kinetics, first order kinetics. Remember, in zero order kinetics, it is the constant amount of drug which is excreted. In first order kinetics, it is the constant fraction of the drug which is excreted. So this is what I want you to highlight. Zero may basically O, okay, remember that O is the amount. In first order kinetics, it is the constant fraction which is excreted. It is constant fraction which is excreted. Okay. Now, here the drug is following zero order kinetics. दिया गया है कि 40 milligram was cleared in 90 minutes. So how much amount of drug was given basically? हमने दिया 200 milligram. After 90 minutes, 40 milligram was cleared. That means gone out of the body. So what remains is 200 minus 40, that is 160 milligrams. The question is asking after 3 hours. 3 hours basically means how many minutes? 3 into 60, that is 180 minutes. 180 minutes means how many duration of 90 minutes? 2 slots of 90 minutes, right? So the first 90 minutes, the next 90 minutes. That is what basically is 3 hours. जब हमने 200 milligram दिया, 90 minutes में 40 गया, the drug remaining is 160 because this drug is following zero order kinetics. So a constant amount will be excreted in every 90 minutes. First 90 minutes में अगर 40 गया, next 90 minutes में भी constant amount जाएगा, that is minus 40. So 160 minus 140, that will be 120. So the answer is 120. This completes the 3 hours. 1.5 hour, 1.5 hour. This completes 3 hours. Right? So basically you need to remember that zero order is constant amount and first order is constant fraction. Now if I change the question to first order kinetics, rest everything is the same. The same question, everything is same. We have given 200 milligram in the first 90 minutes. It is 40 milligram which is gone. So 160 remaining. How much will be eliminated in the next 90 minutes? That is a total of 3 hours if this is first order kinetics. So remember that in first order, it is a constant fraction. So how much our fraction is going in the first 90 minutes? How much is the fraction? 40 upon 200. That means it is 1/5 fraction which is going. So in the first 90 minutes, it is 1/5 fraction. In the next 90 minutes, it will be 1/5 of this quantity, 1/5 of 160. 5 3s are 15, 2. That means minus 32. 32 will be eliminated. So 160 minus 32 is basically 128, right? And that is why the answer is 128. Okay, the answer is 128 because basically this is first order kinetics. So it is constant fraction which is eliminated. Is this understood by everyone? So why in zero order the answer is 120 and why in first order the answer is 120? The basic concept, constant amount and constant fraction. Okay? So let's quickly see this table of difference between first order and zero order kinetics. The first order kinetics are basically linear kinetics. Okay, that is the linear kinetics. First order is a constant fraction is eliminated. Zero order is a constant amount is eliminated. So basically in zero order, irrespective of how much is the plasma concentration of the drug, it is independent. The rate of elimination is independent. Like we saw 200 था, तभी भी 40 eliminate हुआ, 160 हुआ, तभी भी 40 eliminate हुआ. So it's not dependent on the plasma concentration. This is constant. While here, the rate of elimination is proportional to plasma concentration. Like we saw when it was 200, 40 was gone. When it was 160, 32 was gone. So it's depending on the plasma concentration. Okay. In first order, remember that the clearance and the half-life remains constant. Okay. So remember that in first order, this remains constant. So when you write first order is basically fraction. So remember it has constant T and a constant clearance. Okay. The T half is constant. Here it's the opposite. They are variable. Okay, they are variable. Is this clear with everyone? Okay. Most of the drugs follow the first order kinetics. Very few drugs follow the pure zero order kinetics, like alcohol is the one. Any drug, when it has a high concentration, it saturates the receptors, then it may show the zero order kinetics, like phenytoin. It may show zero order kinetics at the high concentration. 0 watt is basically the mnemonic to remember. Okay. So that was about this, the first order and the zero order. So basically remember, rate of elimination is directly proportional to plasma concentration raised to power 0. So if it is raised to the order of kinetics, if it is zero order kinetics, anything raised to 0 is 1. That means it is constant. So that is why in zero order kinetics, the constant amount is eliminated. In first order, it is going to be directly proportional to plasma concentration raised to 1. That is plasma concentration. So it is dependent on the plasma concentration. All right. So that is first order and zero order, fraction and amount. Fraction is constant T half. Here the T half will be variable. Okay, the T half will be variable. All right. Now let's go to the next question. I think yes, this is the last question. Question number 7 from the test. Drug remaining in the body after 3 half-lives. Now a very, very logical question which you could have solved just based on the cheat code. Okay, just using the cheat code, you could have solved this question. What is the cheat code? The question is, how much is the drug remaining after 3 half-life? अगर हम 100 से स्टार्ट कर रहे हैं, 1 half-life के बाद it is 50. Second half-life के बाद definitely it will be less than 50. After 3 half-lives, definitely it's going to be less than 50 for sure, right? It's gonna be less than 50. The only option which we have less than 50 is 12.5. 75, 87.5, 94 is more than 50. So automatically they are not the answer. So remember that many times we think that numerical based question tha, but more than numerical based question, it is a conceptual cheat codes wala question that we need to apply. Now coming to the concept, how the answer is 12.5. 100 हुआ, first half life ये हो गया 50. How much is eliminated? 50. Okay, so 50 remains and the 50 is eliminated. Second half life 50 का half होगा plus 25 eliminate होगा, बचेगा यहाँ पे 25. So total eliminated is 75. Third, again the half eliminated, 25 ka half plus 12.5 eliminated. What remains is 12.5. So basically how much is eliminated is 87.5. After 4 half-life, again iska half 6.25 and what remains is 6.25. Total eliminated is 87 plus 6. That is basically 93.75. Somewhere is what is eliminated. So after 3 half-lives, if you see, this is the value. Okay, this is the value. This remains in the body and this much is eliminated from the body. Of course, the amount remaining will be less as compared to the amount eliminated from the body. Okay. So next time if I change the question, how much drug is eliminated from the body after 3 half-lives? It's 87.5. This is eliminated after 4 half-life. This is eliminated after 2 half-life. Okay. Clear with everyone? So these were the questions and this is what is mentioned here. The last one. First में 50% eliminated. Second में उसका plus half. 50 plus 25. Third में 87.5 और fourth में 93.75. So basically, after the 4 half-life, you'll see that the drug is reaching the steady state plasma concentration. Steady state is at 4 to 5 half-lives. Okay, 4 to 5 half-lives. Elimination का curve भी basically similar आता है. ये drug giving वाला curve है. Plasma concentration increasing. ये drug elimination का curve है. ठीक है? So this is about this. Okay, if both 4 and 5 are given, what should we choose? Ideally, there should not be this option where both 4 and 5 are given. ठीक है? 4 will still be better in that case, but hopefully you will not get a question ki jahan pe dono options mein honge. All right, so guys, let me know how many of you enjoyed the today's test and then the discussion. How many of you enjoyed giving the test, which was very similar to your actual the exam jaisa platform. So please let me know so that I can keep conducting more tests like this. And we are meeting again in the next 45 minutes or 50 minutes or so at 7:35 p.m. on the Unacademy app for a free live class. That's a special class where we discuss the CVS Pharmacology ke mnemonics and the remaining of general pharmacology ke mnemonics also. Right? I'll try to put the MCQs as well. Okay? Okay. So thank you so much, Sayansan, Kavya, Jyoti. That's great. So I'll keep giving you such surprise test and discussion so that you get to know as well. You get to assess yourself also, and we have the discussion also. Okay, Dr. Sri Rathore, should we read USMLE step 1? I would say now that you have time, please do that. Whatever subject you are doing or you are done with, उसको फटाफट रिवाइज कर लो from step 1. Don't give it like very additional time. ठीक है? I'll definitely add PYQs. Okay, I'll do that as well. Okay, I'll be sending the group of the special class on the Telegram group, everyone. Please enroll for the same. And we'll be discussing some very good mnemonics in CVS pharmacology and general pharmacology. Okay? Okay, thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, and keep winning.